Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I'm a public health entrepreneur with over 25 years of experience in both healthcare and public health. And I've been podcasting since 2017, and I've supported many entrepreneurs along the way. On this podcast, we talk about topics of interest at the intersection of public health and entrepreneurship. So today I have a special guest joining me, Dr. Linda Gordon, who's going to share a bit about herself and her journey. And we're just going to dabble a little bit in conversation. So, Dr. Gordon, introduce yourself and tell us a little bit about who you are and what you do.
Sure. My name is Dr. Linda Gordon. I've been a pediatric public health professional, pediatrician for over 20 years, public health professional for around 5 years, and I'm still a working pediatrician. I work in the Birmingham area as a general pediatrician. I'm also the owner of Childverse Inc., and we are a public health company. We use creative media and thought leadership to improve the medical sophistication of families, improve their health literacy so they can respond to crisis or simply events of daily living. If they are parents or children, parents or advocates of children with mental illness. So we have a children's book literature series, Not to Worry, Lucille, and it provides an optimistic, hopeful worldview for preschool children. We have a resource website, childverseinc.com, that provides academic resources, a blog. Our blog has varied points of view, professional, personal. So we have subject matter experts from behavioral medicine, education, law, parents of affected children. So we try to offer as much insight as we can. That's a bi-monthly publication. I occasionally add to that website with tips for parents and anticipatory guidance. And we are trying to grow and develop our consulting arm. We would like to consult families, advocates, organizations on how to improve their health literacy. That's us.
I loved hearing you describe, explain and introduce your business. Of course, we've worked together for a good while,
Yes.
and I love what you're doing. It's so important. I'm gonna throw some extra questions in here just
Sure.
because, just to sift out some more kind of information. Um, when did you first become interested? Kind of like two parts here. When did you first become interested in public health, and then also this kind of niche area of mental health for children?
So I became interested in public health in medical school. I went to the University of Chicago School of Medicine, which is in Hyde Park and borders Southside Chicago. That's when I was introduced to the concept that social determinants, which they didn't call it that back then, but what we now know as social determinants can have adverse effects on health outcomes if they're not addressed. Later in my residency training, which was at Harlem Hospital Center in Harlem, New York, I really learned how being a good doctor and improving health outcomes meant including efforts to address social determinants in your patient care. I had it in my mind that I would gain some experience and formal education in public health down the road. And that happened after I had been practicing for a number of years. I had the opportunity to go to Emory's University School of Public Health. By then, the presence of electronic medical records and databases and the concept of using data to inform decisions that affect individual and population healthcare had been developing. And so I chose to study informatics. And informatics is very broad. It can include pure coding and the mechanics of how electronic health records work. It can include the little more vague information flows. How do you communicate with patients? How do healthcare systems communicate with each other? How do you communicate across disciplines? So that was my journey over years of how I was introduced to public health and how I found myself getting formally trained in public health.
Yeah, I definitely appreciate the journey. Very similarly, I well remember the time before a lot of terms and phrases before we had electronic records and
Yeah.
medical records, so there's been so much progress. Really in a relatively short period of time, if we think about our career span so far. And then I like the reminder because I know you specialize in, health informatics. And I could see that really spilling into what you're doing now. And then even thinking more about your connection, your introduction, in both of those settings in Chicago and New York, children, it's kind of like all kind of full circle in a sense. Very
Yeah.
nice. How has, and we're kind of touching on this, but how has some of your previous experience helped prepare you for like consulting and entrepreneurship?
So there is an expression that there is an art to medicine. So we have our formal education, we have institutional guidelines that give a very detailed roadmap for how you identify and treat disease. And then you have to look at your individual patient population, your community, which may be different if you're rural versus urban, ethnic versus majority, according to your sex. And so the art of medicine is how do you apply your formal training and those guidelines to the population that you serve. And so that involves strict training and some creativity. And so, what began to happen as I spent years in practice is the mental health crisis began to rear its head. And in particular, in my specialty of pediatrics, it began to present in children who were younger and younger to a workforce that was limited in size. So instead of behavioral health specialists, psychiatrists, psychologists, counselors, therapists being the only ones to interface with that patient population, generalists were also addressing their needs. And increasingly so because of the shortage of those behavioral health workforce personnel. And so as a result, I began to see there is a need to help parents introduce children to a worldview that is hopeful. There is a need to help parents learn how to have expectations and empowerment with regard to my child has symptoms or a diagnosis, what do I do next? Some of that is built into the way we practice pediatrics. We have anticipatory guidance. This is what you should expect. This is what is considered within the norm. This is not. These are the next steps that we will take. However, you're limited in your encounter, your office encounter. You're limited in your inpatient or emergency room encounter. And even when you do have those exchanges, wouldn't it be nice to lessen the time from which you become to a novice to an expert? And that happens organically in some instances with parent support groups and that sort of thing. But I found that informatics could be used to fill that void. The flow of information, this exchange of information could be used to fill that void. And so I said, I would like to be a thought leader. I would like to be part of that conversation. I would like to be part of that mechanism. One of the things we had to do for our master's in public health degree was a thesis. And one of the things I always used to say to my thesis advisor was, I want to be a part of the conversation. And so, with that in mind, with the clinical background and the public health background, I'm trying to be a part of the conversation, but not just among professionals, among those parents in need. And I want to facilitate conversations. So, our website wants to provide resources from the experts. We have links to American Academy of Pediatrics, National Association of the Mentally Ill. We're adding links to the Children's Defense Fund and CDC. We also have those subject matter experts to add to the conversation. We have those parents to add to the conversation. Ultimately, my dream is that conversation leads to some sort of database that parents can access, and that database is so massive that any parent in need can find the educational information they need from us or related institution, but they can also geographically find what's available close to them. So with that view in mind, I wanted to learn about consulting. I have no training in consulting. That's one of the reasons why I was eager to work with you and develop a relationship with you. And I'm grateful for your teaching and skills and refining. But it was, how do I engage in the conversation and influence the conversation and fill that void that I saw in the healthcare system?
Oh, thank you for that. Because, as a coach, I'm sitting here applauding because we've really come a long way when you are able to kind of, break all of that down. And I know for people listening, I want you to hear the opportunity. And, this is where I think the beauty of consulting as a public health entrepreneur, really being in this space as a consultant. You are the perfect person. You absolutely, your name should be on the chair that is, pulled to the front of that table, because what better set, you're perfectly positioned with, as a pediatrician, with your experience of, years in the, clinical setting, hundreds of children, over time that you've interacted with, and families. And then with your public health, background, your introduction early on, your formal education a little bit later on, and then that provides like such a perfect filter. So if we're going to be looking at, addressing some of these bigger challenges, I mean, you are the person to be invited to the table and be, included in these conversations. And I think that, our listeners may be very inspired to hear just how you've pulled together your business and organized that. But also, I will bet that our listeners know of someone. That's how our network is. Like, we know of someone at an organization, that would need to, and are thinking, wow, I should introduce her to so and so. That's kind of how it pops up in someone's mind. The introductions happen, as how networking opportunities are generated. But I think it will start with the people that are listening to you in this conversation, right, that you're having with me, knowing of someone. Because every time we talk, I think of like someone else that I think you should meet. But I think that, think of organizations that serve children. I'm thinking right now of, in my local area, our children's hospital in the city here. And, Children's Hospital is, a physical location downtown, Columbia, South Carolina. And it is serving children. There's all this clinical setup, right? But connected are all of these partners, community-based partners, other public health and healthcare. It's so intertwined that you couldn't separate. That system works perfectly as a very tightly intertwined multiple industries. Those types of organizations, they're looking to build a new program or develop a new program to serve the needs of children. And I live in a whole state is considered classified as a rural state. So even though I say downtown Columbia, it is still a very rural state, very similar to probably where you are in Alabama, so that, all of these rural community partners that, are maybe even a part of the broader community of the Children's Hospital. There's dozens of programs and leaders that,
Right.
would love
And
to, chat with you and talk with you.
yes, and I'm a general pediatrician. I'm not a psychiatrist. There is a specific need for psychiatry. And I'm not looking to diagnose and treat through my public health efforts like I do in the clinical setting. I'm looking to improve health literacy. So that involves relationships with stakeholders, that involves increasing the flow of information from various points of view to the parents. And it enables the parents to learn how to access the system, use it effectively, assimilate data, make good decisions, have good outcomes. That assimilating data and access, that's where I come in as a public health provider. As a clinician, I'm the general pediatrician. I'm taking care of your needs. I'll manage some behavioral health up to a limited point and gladly turn it over to the specialist. But as a public health provider, the parent needs to understand what the healthcare system has to offer. And then with regard to children, what the educational system has to offer, what the community system has to offer, and how they're interrelated and how they're accessed so that you can have wellness for your child, which is physical wellness, mental wellness, doing well in school, getting the services that they need. So there are many tiers that are not addressed in the general pediatric office or in the behavioral health office, but they need to be introduced and developed with the parent understanding it's all related. And I think our traditional view of medicine is you go, you get a diagnosis, you get medicine, that's it. And
Right.
so increasing that medical health literacy to develop medical sophistication does involve utilizing all those partners. Medicine and public health have traditionally been siloed. They started out together back at the turn of the century, then with their individual and independent ways. And so I'm trying to learn how to, I'm an introvert. And so I'm learning how to network and build relationships with those partners so that we can go forward
Yeah.
and help parents out.
I thank you for adding that extra detail in there. And that's exactly why I get excited about you as a thought leader sitting
Mhm.
in those discussions and those conversations,
Mhm.
because in those settings you're not diagnosing or treating children.
Mhm.
You're not, you're not looking at doing the practical, taking the clinical or
Mhm.
practical steps.
Mhm.
You're having this view, and it's the view and the lens and the background and perspective that is so
Mhm.
valuable when we're
Mhm.
making decisions about the next programs or what needs to happen with
Mhm.
our children. We
Mhm.
need thought leader like you to be able to be in
Mhm.
those conversations to say, yes, this is needed, or to bring that perspective. And you're
Mhm.
just so uniquely designed. So I am,
Mhm.
um, I get excited every single time we have this conversation, because I know
Mhm.
that there are, and I'm even thinking of, there's multiple industries. We're making it almost like, oh, it's public health and healthcare, like those are the only
Mhm.
ones. There's so many other
Mhm.
industries that would love to have you at the table as they're
Mhm.
looking to turn over ideas and decide what needs to
Mhm.
happen. As you were talking, I was reminded of my first few very large clients that happened right at the peak of the pandemic, were in the
Mhm.
IT industry. It
Mhm.
was like they wanted a thought leader. They brought me in for thought
Mhm.
leadership because they were trying to
Mhm.
understand contact tracing and what this whole virology thing is about. And I had a background in
Mhm.
virology. So, there are other industries that really would love to just have you as that thought partner as they're
Mhm.
creating and developing, um, and trying to decide, how do we help solve this. It's this,
Mhm.
multi-industry overlapping approach where we collaborate and come together. So you are just ideal for that.
I hope so. I would like to be a part of the conversation. I have created a mechanism for that. I'd like it to evolve.
Yes, yes.
So,
So if you're listening, I guess Linda's wanting some. We're open for introductions to the right types of leaders, and some people are in maybe sitting in their office right now and thinking, oh, we just had a meeting about this and we're looking for blah, blah, blah. That's how things come up in our minds, and
Right.
that's how we network. So this is great. I'm loving this conversation. I know that I think you mentioned this a little earlier. You are seeing patients in clinic, and you're also running and operating your business right now. Is that and I asked this question realizing that if somebody had asked me this question before, I wouldn't have been able to clearly answer that because I was just kind of open to what was happening. But do you have a clear plan of where you'd like to be in terms of 100%
Right. I'd like
business?
to always see patients, but scale back a little bit on the volume and the frequency
Okay.
and develop more of the public health component. Pediatrics is cyclical. We're in the back to school season. It's rough. It's a lot. and I'm
Everybody's sharing all their germs and
right. And
that's
I'm getting older, so I'm looking to slow down the pace a little bit, but not eliminate that from my experience.
Yeah. You just gave me a flashback. I remember my kids were younger. I have one in particular who would always get strep. As soon as
Hmm.
they go back to school, within the first 30 days, would have
Hmm.
strep. So, okay. So I have a couple of questions, and I'll just kind of I'll just put them together and you can, answer them both. But I like to share kind of it's easy for us to share all the wonderful things that we like about this world of entrepreneurship. But I really like to do kind of both extremes. I'd like for you to share what you like most about consulting and entrepreneurship, and then also share what you like least about it.
I most enjoy the creative aspect, that you get to apply that art to how you solve a problem. And so, given that we're in media, in print, and digital, and social media, there's a lot of creativity. And so I like that expression. Um, I am very much enjoying meeting so many people that are so highly skilled and so diverse, and the opportunity to interact with them and collaborate. I'm enjoying that a lot. Um, and I'm enjoying the excitement of development, branding, learning new skills were totally foreign to me: digital marketing, SEO, analytics. On the flip side, it is overwhelming how much I still have yet to learn. It is overwhelming that, when you're creating something from scratch, you really do have to build it from the ground up. And so there may be a template, but a lot of times there isn't. And you learn, you fail, you learn, you succeed, all, at the same time. Um, and I am overwhelmed by how much I have to learn, but also encouraged in that I'm learning I don't have to learn everything. So so it's a process. It's not overnight, and um, being in that business development stage, learning who your customers are, that's very challenging. Learning who is your customer. Um, and trying to expand that as much as you can to have a wide reach. So those are some of the highs and lows.
Yeah, yeah. I can appreciate all of that. I think that initially you and I worked together one on one back when I offered one on one coaching, and
Mhm.
then when I started the mastermind, I invited you to join the mastermind, and I think that as you're going through this, I can see where our community, which I brag about all the time, but at our most recent retreat, you were there, and I think that this was there's a lot of special attention your way, which I love for you because you hear a lot from me, but a lot of
Yeah.
the members in the room, and of course we do that online in our space, but especially in that when we get in person, sometimes that's where the magic really happens. But
Mhm.
you received a lot kind of poured into you, and
Yes, I'm
um, you know.
grateful. It
There's a
was
lot.
really
It's almost like the
appreciated.
water hose concept, right? Drinking from
Yeah.
the water hose. But
Yeah.
so was that you said you're grateful? There's a lot
Yeah.
of things are really poured in to you during
Yeah.
that time, right?
Mhm. Mhm.
Yeah.
Yeah. I mean, exciting to meet so many dynamic people and who have their own particular spin on how they can impact public health, who have so many varied skill sets, and you can say, oh, and so many ideas, and um, who are so much about their own personal development, but also have enough to pour out of their cup for you as well. So that's all wonderful,
Yeah.
and I'm enjoying the community.
Yes, yes. I think I get as much, I get a lot of benefit from everyone and hearing ideas. And, I was thinking about one of the things you said about you realizing, yeah, there's so much to learn, but you also realize I don't have to be the expert of everything.
Mhm.
That was a great, well, that's been a great aha moment for a lot of people.
Mhm.
Um, yeah, really glad that you're in that group with us, and excited about all the things that you're doing and where you're going. Just as a final wrap up, I would just like for you
Mhm.
to just share. You've touched on it throughout our conversation, but
Mhm.
in what ways are you advancing public health with your business?
I am advancing public health literacy. I am advancing the way we use social media and web media to reach everyday people and give them access to resources and conversations, academic, professional, personal, that lets them accelerate the rate at which they become experts for their own children and for the children they advocate for. And so I'm using public health education to promote health literacy with media, and in that way.
Awesome.
Mhm.
Awesome. Well, thank you so much for being here. I thoroughly enjoyed this conversation. I'm pretty sure our audience did as well. I'll make sure that everyone, you get the links in the description for this
Mhm.
episode or in the show notes for how to connect
Mhm.
with Dr. Linda Gordon. And I
Mhm.
really encourage you to do so. So
Okay.
thank you so much for being here. Really
Thank
appreciate
you for
it.
having me. Okay.
So, everyone, until next time, have a fantastic rest of your day.